So just a quick update on the new 6 cases today. Of the new cases, one is linked to Stratton Finance, has been in quarantine for their entire potentially infectious period, so no new exposure sites from that individual. One individual is linked to Brighton Beach Hotel. They've been staying at their home in Anglesey, and therefore there are a number of exposure sites in Anglesey which have been posted online. As you know, we've got a network of local public health units in Victoria who really drive our work at the moment with contact tracing for COVID. And I've got a great deal of faith in the Barwon Public Health unit, who know the area very well, who've responded through 2020 to colic outbreaks and really as many numbers as some other jurisdictions in Australia have dealt with. So there's a great deal of expertise and local understanding. I've got enormous confidence in them managing this situation. One case is an individual from Victoria who holidayed in Jervis Bay with his family, and the Department of Health advised Victorians last night on that. And of course, New South Wales Health have advised on the relevant exposures in their jurisdiction. His family have also tested positive. That's a spouse and 2 children, making up the remaining 3 new cases. Those 2 children attended North Melbourne Primary School, so that school is closed and contact tracing is underway. And we're still investigating who the index case or first case might be in this family, and indeed how they've acquired it. That's not absolutely clear at this stage because there's no crossover with known exposure sites from the initial interview. As we've discussed this week, this variant of concern is starting to show up in places where normally it would be less likely. So the Brighton Beach Hotel, that was an outdoor dining setting, well ventilated. You wouldn't expect transmission to occur. We still had it as an exposure site. We still informed people to test and isolate until returning a negative. But in fact, all of those people will need to be in quarantine because transmission has occurred there. That's not something that we routinely see, and we didn't routinely see it in 2020, but we have to bear in mind that all the variants of concern now are really a step up to some degree. This Kappa variant, as it's now called, is not the most infectious, but it is more infectious than anything we saw in the beginning and middle of 2020, so we have to bear that in mind. At least 1 in 10 current cases have caught this virus in those casual contact settings, so not the workplace and home close contact settings where we know and expect transmission to occur. I have described it as an absolute beast because we have to run it down to the ground. There are a dozen countries that had no community transmission going into 2021 that have now lost control, that have community transmission and will probably not bring it back to a point where they've got no community transmission again. We have to take a path where we drive this virus back down completely so that we can get control into the longer term. The fact that we're seeing transmission in some of these casual Tier 2 exposure sites or even Tier 3 exposure sites means that we have to re-examine those sites. We have to reach out to people in some of those exposure sites and ask them to quarantine rather than just test and isolate because of the more contagious strain. Again, I'm not giving it magical qualities. I don't need to overplay the danger here. With 150 million cases globally, with 3.5 million deaths, with probably 1 to 3 million deaths just in India in recent months, with the gross underestimation in many countries of the number of true deaths that have occurred, it's absolutely clear that we need to run this completely to ground to be happy that we can open up appropriately. We can't let it get away. We can't go to settings where it would move unchecked with huge numbers of people exposed. So we've got restrictions on for another week to limit the number of unique close contacts that people will have and contain this virus as we did last year so successfully. Thank you.